Robert F. Kennedy Jr. is a man on a mission. And over the course of this month, he hasn't just ended the US government funding for mRNA research. That would be big news in and of itself. But that's only one small part of a much bigger shakeup of the entire vaccine industrial complex. Not just the mRNA technology, and not just the manufacturers, but the entire business model, including payments and incentives that these pharmaceutical companies offer to doctors, which create an incentive for doctors to actually fire their patients if those patients won't stay up to date, whatever that means, with the vaccine schedule. Now, unfortunately, here in Australia, there is no sign of us following suit in the near future. And in fact, we've built our own very large mRNA production facilities. But the fact that this is happening at all, that any mRNA research is being cancelled anywhere in the world, let alone that it's happening in the country that created these nightmare drug cartels in the first place, let alone that it's happening in conjunction with the deconstruction of their perverse business model, is a fantastic step in the right direction. And we need to talk about it because we need to work towards an Australia that follows suit. My name's Topher Field, this is the Topher Project, and I help busy people like you to keep up with the world as it changes around us. I am 100% viewer supported, so please buy me a coffee via the button at topherfield.net and check out my books, DVDs and merch at goodpeoplebreakbadlaws.com. Now, let's dive into the first of a series of massive announcements by Robert F. Kennedy Jr.
Hi, it's Robert F. Kennedy Jr. here, your HHS secretary. At HHS, we have a division called the Biomedical Advanced Research and Development Authority, or BARDA. BARDA drives some of our most advanced scientific research. It funds developments of vaccines, drugs, diagnostics, and other tools to fight emerging diseases and national health threats. Over the past few weeks, BARDA reviewed 22 mRNA vaccine development investments and began canceling them. Let me explain why. Most of these shots are for flu or COVID, but as the pandemic showed us, mRNA vaccines don't perform well against viruses that infect the upper respiratory tract. Here's the problem. mRNA only codes for a small part of the viral proteins, usually a single antigen. One mutation and the vaccine becomes ineffective. This dynamic drives a phenomenon called antigenic shift, meaning that the vaccine paradoxically encourages new mutations and can actually prolong pandemics as the virus constantly mutates to escape the protective effects of the vaccine. Millions of people, maybe even you or someone you know, caught the Omicron variant despite being vaccinated. That's because a single mutation can make mRNA vaccines ineffective. The same risk applies to flu. After reviewing the science and consulting top experts at NIH and FDA, HHS has determined that mRNA technology poses more risks than benefits for these respiratory viruses. That's why, after extensive review, BARDA has begun the process of terminating these 22 contracts, totaling just under $500 million. To replace the troubled mRNA programs, we're prioritizing the development of safer, broader vaccine strategies, like whole virus vaccines and novel platforms that don't collapse when viruses mutate. Let me be absolutely clear. HHS supports safe, effective vaccines for every American who wants them. That's why we're moving beyond the limitations of mRNA for respiratory viruses and investing in better solutions. Thank you.
Okay, that was the entire statement from Secretary Kennedy. And in some senses, it speaks for itself, but actually, there are a few things that we need to talk about. He points out that mRNA jabs target a single antigen, and that means that a single mutation defeats that particular jab. And to you and me, that seems like a bad thing. The jab's no longer effective. But for the drug companies, well, that's not a problem. That's repeat business, because we'll be expected to simply line up for the next and the next and the next jab, chasing every virus and every mutation. No wonder they loved it. Cast your mind back to the initial rollout of the mRNA jabs. We were told that once you'd had 2 jabs, you were fully vaccinated, and we were told that they would work against future variants as well. We now know that that wasn't just wrong. We know that it was a lie because mRNA vaccines targeted at a single antigen simply cannot provide broad-based protection. They are coded for a single virus, a single variant. And the whole business model is built on the idea that with every mutation, every variation, we would have to get another jab. Okay, so that's the end of new mRNA vaccine development for respiratory viruses in the US. That's a good step in the right direction. But why is this happening? What was the catalyst for such a reversal? RFK Jr., despite what his haters will tell you, is not anti-science. He's not even anti-vaccine. He just insists on following the evidence. And he mentioned there that the evidence said that these mRNA vaccines for upper respiratory viruses proposed or created more risk than benefits. Special advisor to the HHS, Dr. Stephen Hatfill, filled in Steve Bannon at the War Room.
Walk us through what led to the decision of finally getting, stopping the underwriting of American taxpayer for this experimental gene therapy, sir.
Hi, Stephen. Good to see you once again. What happened is that the data had accumulated to the point where meta-analysis studies could be done. These are very comprehensive analysis, and it virtually came back consistently that there was no benefit to risk ratio for taking a messenger RNA vaccine. In fact, it was more dangerous to take a vaccine than it was to contract COVID-19 and be hospitalized with it. Now, we're now in 2022 that this data started to come out. The side effects for this essentially gene therapy was so enormous and progressive, it was difficult to fathom. And then finally, a few months ago, some of the detailed biochemistry studies started to appear in the literature. And the sudden flood of messenger RNA, it appears irrespective of what the messenger RNA insert is coding for. Just the sheer amount of number of millions of molecules of messenger RNA entering the cell is creating biochemical havoc. It's disrupting protein metabolism. It's interfering with tumor suppressor genes. It's damaging the mitochondria, the powerhouses of the cell. It had to be stopped.
So, these mRNA jabs for the upper respiratory tract infections are not particularly effective and they cause harm. And when you put those two together, there is a risk to benefit ratio that simply doesn't make sense. Understood. Now, this is a good moment, though, to talk about what makes an mRNA jab different to a vaccine as we've previously known them to be. See, a vaccine introduces into your body something for your immune system to fight against. But the key is that it's been made harmless first. So typically vaccines have been either a relatively harmless part of a live virus or an entire virus but already dead. And in both cases, the thing for your body to fight against is being directly introduced by the vaccine itself in a controlled quantity. In the case of mRNA vaccines or jabs, they added an extra vitally important step. This time they're not injecting the thing for your immune system to fight. What's being injected are the instructions for your body to manufacture the thing for your immune system to fight. Now, this creates an entirely new variable. How much of that thing will your body produce? This thing that your immune system will then fight, how much of it will your body make? Well, the amount varies enormously from person to person depending on their physical health and their immune system sensitivity, and it varies in ways that we still don't have a good handle on. And that's largely why these mRNA jabs have been so devastating to the health of otherwise healthy young men, for example, developing heart conditions. Their body got the instructions to make those antigens and then boom, it did what it was told too well and with devastating effect. Now, hear the same thing from Secretary Kennedy when he spoke at this symposium on rural health.
The other issue is the way that it distributes in the body, the way that it migrates in the body, there's no control over it and no predictability. So it goes to every organ. It turns your body into an antigen factory where you're manufacturing antigens. And different people need different loads of antigens. And in a regular traditional vaccine, the antigen content is very carefully controlled.
for that reason, because you can injure people. And we've seen now these epidemics of myocarditis and pericarditis, particularly in kids. And for upper respiratory, for some illnesses, mRNA vaccines may be very useful, and and that would include cancers. But for upper respiratory infections, we canceled 22 trials for upper respiratory infections.
Now, I want to draw close attention to what RFK Jr. said at the end there. He made a clear distinction between mRNA jabs for things like cancer, which is still being researched and shows considerable promise, as distinct from mRNA jabs for upper respiratory tract infections. Now, this is my point about RFK Jr. His haters say that he's anti-science, anti-vaccines, uneducated, and acting out of fear. I find him to be exactly the opposite. He understands the science and the evidence. He's being decisive where it's needed regarding things like eliminating the last of the mercury adjuvants in flu vaccines out of the US, and now also ending research into mRNA jabs for COVID and flu. But he recognises that an mRNA gene therapy might work well for other illnesses such as cancer. He's not throwing the baby out with the bathwater. But what he is doing, on top of what we've already discussed, is destroying the perverse financial incentives and coercion that these massive drug companies apply to doctors. Watch.
Hi, I'm Robert F. Kennedy Jr., your HHS secretary. Let me ask you something. Should doctors make decisions based upon what's best for their patients or based upon what makes them the most money? It's not a tough question, but we've inherited a healthcare system that constantly pushes doctors toward the latter. It rewards certain treatments not because they're better for the patient, but because someone profits. Take what happened during COVID. Hospitals were paid to report staff vaccination rates. Those numbers were fed into the National Healthcare Safety Network, then published on the CDC website to shame any hospital that refused to become an enforcer of federal vaccine mandates. Today, I'm proud to announce we've eliminated that policy by repealing a dangerous Biden-era provision in the CMS inpatient payment rule. And we're not stopping there. We're scanning every corner of the healthcare system for hidden incentives that corrupt medical judgment. What we're finding is alarming. Doctors are being paid to vaccinate, not to evaluate. They're pressured to follow the money, not the science. We've recently uncovered that more than 36,000 doctors had their Medicare reimbursements altered based upon childhood vaccination rates. That's not medicine. That's coercion. It's immoral. It has no place in a constitutional democracy or in a system that claims to protect children. Medical decisions should be made based upon one thing and one thing only, the well-being of the patient, never on a financial bonus or a government mandate. Patients deserve honest, uncorrupted advice from their doctors. Doctors deserve the freedom to use their training and to follow the science and speak the truth without fear of punishment. Doctors should be guided by medical judgment and their Hippocratic oath, not by financial incentives or government mandates. That's what this policy change is about, and it's just the beginning. Thank you very much.
Now, this is a movement that is gaining traction around the USA. There was recently a Voices of the Vaccine Injured hearing, a Senate hearing in the US, chaired by Senator Johnson, that laid it bare again for anyone willing to listen.
What is the truth? Because I hear back and forth. I mean, do pediatricians get incentivized with percent vaccination of their...
Yes. Dr. Paul Thomas has done a very good video on that, and many other pediatricians have followed. Maybe Dr. Hooker could answer better on that.
Yeah, they're typically incentivized directly by HMOs. HMOs buy and sell vaccines, so vaccines are big businesses for HMOs. But the incentivization is usually anywhere from $200 to $600 per fully vaccinated patient, as long as their vaccines, a certain percentage of their practice is fully vaccinated. So some pediatricians can make upwards to $1 million or more a year just in those incentives.
I've also heard stories of pediatricians basically firing patients because they won't get vaccinated, because that
is correct.
We hear that story over and over again. And also the lies that the pediatrician tell us that our baby will die if we don't get vitamin K at birth. The baby will bleed out before it gets to the car. And these stories, if you don't get the HPV vaccine, then you will die of cancer. These parents have told us these stories, and they're the same over and over again. How can they get away with lying like that to us, the parents?
The incentives built into this system are absolutely perverse. The coercion involved, not only in the COVID and mRNA jabs, although that was a particularly egregious example, but also in just the actual vaccine industry. These perverse incentives and this coercion should have rung alarm bells long ago. And the truth is that there were people trying to ring the alarm bells long ago, but they were ignored because the status quo is making a lot of people a lot of money. Or at least it was until RFK Jr. came along. I said when he was appointed the HHS secretary that this would be bigger than Doge. And I think he's absolutely delivering on my high hopes for him in this role, bringing everything back to what the actual science and evidence says. Now, like RFK Jr., I am not reflexively opposed to every vaccine, nor am I even opposed to mRNA as a delivery technology. Like I said, there's some really interesting research going on in the area of cancer with mRNA. And we have to keep in mind that just because the risk-to-benefit ratio doesn't stack up for using mRNA in an upper respiratory tract infection, well, that doesn't mean that it might not add up for uses where the risk to the person from the illness itself is far higher, such as in the case of cancer, which means that the dangers from an mRNA vaccine might be a risk more worth taking. And it's worth me adding, for anyone who maybe isn't already familiar with my work, that I am 100% always and forever opposed to the use of coercion or perverse incentives in medicine. Whatever medicines we have, no matter how advanced we think they are, they should never be mandatory, and the choice should always be left to the patient. What was done with the mRNA jabs during COVID was a crime and a human rights violation. And what's being done with these financial incentives for doctors is disgusting. And frankly, people should go to prison for turning patients into pincushions and ATMs at the same time. Now, in case you missed it, RFK Jr. removed the last of the mercury adjuvants from US vaccines a few weeks ago. Now, he's cutting at the very heart of the Big Pharma financial system. And if he keeps going like this, Robert F. Kennedy Jr. could end up proving to be one of the most consequential members of Donald Trump's administration. Let's see how long it takes for our regulators here in Australia to sit up and pay attention. Yeah, maybe don't hold your breath on that one. My name's Topher Field, this is the Topher Project, and I help busy people like you to keep up with the world as it changes around us. I am 100% viewer supported, so if you've appreciated this report and that I've brought you news and perspective that you were not aware of already, then please buy me a coffee via the button at topherfield.net and check out my books, DVDs and merch at goodpeoplebreakbadlaws.com. Thank you so much for watching to the end. The algorithm loves you and so do I. Please like, comment, subscribe, and as always, think free.